According to the American Association of Clinical Endocrinologists, 27 million Americans suffer from thyroid dysfunction, half of whom go undiagnosed.
Subclinical hypothyroidism, a condition in which TSH is elevated but free T4 is normal, may affect an additional 24 million Americans. Taken together, more than 50 million Americans are affected by some form of thyroid disorder. I'm Karen Martel.
And I'm Amie Hornaman. And today we are co-hosting this episode to discuss the root cause of hypothyroidism.
Yay! I'm so stoked to be doing this, Amie. I think that this is a long time coming, that we should have done this probably a long time ago, but hey, we're here now and
doing it now.
It's so important, don't you think? I mean, you solely work with thyroid patients. I work with a lot of thyroid patients too. And it is so common for thyroid patients to go to their doctor, be put on their levothyroxine, sent back out the door, and I'll see you in a year. And nothing is ever discussed about, hey, why do you have hypothyroidism?
Right. Right. And even if you are on the right medication and not on T4 only, which we dislike, even if you're on the right medication, you want to know why. You want to know about those other factors that you can be looking at, improving upon to help that med work better, to help your thyroid, if you still have one, work better on its own while you are supplementing with thyroid hormone replacement therapy to just improve your life.
Yeah. And this is a good time. I think we should just do a little recap of both of our history with hypothyroidism. You guys can go back. We've both done interviews on each other's podcasts and you can hear our stories there, but we'll do a little recap for those that haven't listened to those. But I was one of those people that actually discovered I was hypothyroid. I had a totally normal TSH, normal, low, but normal T4, free T4, and a very low free T3. So I finally got diagnosed. My naturopath said, here's your desiccated thyroid. So I was like, perfect. This is exactly what I need. And started taking it. I started increasing my dose. I was optimal. It was the best I ever felt. And I remember my sister saying to me, like, well, why are you taking you're taking all this thyroid hormone, but you don't know why you actually have it. And I'm like, it's probably because my naturopath had said to me, it's probably just familial, like it's coming through like genetics or something. And so I just took that and I was like, yeah, it's because it runs through my family. My granny had it, like, this is why. So I, go on my merry way, felt the best I'd ever felt, was losing weight effortlessly, was just like, this is it. I finally found the answer to my problems. And about 6 months in, I hit a wall. And I got so hypothyroid, way more hypothyroid than I was prior. My labs looked beautiful. I was in the upper range for free T3. My free T4 was middle of the range. My TSH was suppressed. Everything was great looking at my labs. Yet my metabolism plummeted. I gained 10 pounds in a month. I couldn't get off my couch. My skin was super itchy. I was severely depressed, like most depressed I've ever been in my life. And I'm going, what just happened? And it took me a bit to figure out what the hell just happened here. And I was like, thank goodness one of my best friends is Al Russ, who had a reverse T3 problem. And she's like, test your reverse T3. And sure enough, my reverse T3 had climbed and had gone from a 15 to a 19. And now people would think, well, that's fine. That should be fine. That's in range. I think it's anything over 21, is it, Amie? That is flagged? 24.
Yeah, you go all the way up to 24 before you even get the flagged.
Right. And so it went to 19 and everything shut down in my system and it was terrible. And so since then, that was a couple of years ago, I have had to figure out what is the root cause, because when there's especially a reverse T3 in there, we know then that there's something affecting my conversion of T4 to T3, and it's making me go into a storage hormone. So taking all that desiccated T4 in that desiccated thyroid was shuttling into reverse T3 and making me very sick. And it took me a very long time to recover. And I've just been on this road of trying to figure out, and we're going to get into what my causes were. And I'm going to talk about that today. But Amie, let's start, tell us what happened with you.
Yeah, we share such a similar story. Different starting point, same end point. So for me, this is going back 20 some years. I was competing in fitness figure competitions, kind of like bodybuilding competitions, only, you're on stage in a bikini and doing some fitness modeling. And so dieting down, dieting down. And I had done this so many times before, so many times. So I knew how my body would respond. I'm not naturally thin by any means. I have diabetes and obesity in my family. So I always had to work my butt off to get down to that show shape. And this was time number, I don't know, 10, 12, 15.
Wow.
And this time I was gaining weight instead of losing weight. And by the time the scale hit 20 pounds plus, I stopped weighing myself. I mean, that was just my frustration point at the very top. The very top of my frustration was 20 points, 20 pounds. And then I wouldn't get on the scale anymore. And I went to doctor after doctor saying, I know something is wrong with me. Here's what I'm eating. Here's how many times I'm going to the gym. Here's what I'm doing every day. And I still heard, eat less, exercise more. There's nothing wrong with you. They couldn't even use the "you're just getting older" on me because I was only in my 20s, right? So they had very little to work with. They were just, you're fine. You're fine. You're normal, air quotes. You're normal. So I kept going, doctor after doctor. I wouldn't give up. Seventh one finally diagnosed me with hypothyroidism. And honestly, back then, I don't think they even tested my antibodies. I don't ever remember hearing Hashimoto's back then. So it was just hypo, here's a pill. I was stuck on T4 only. So I got my Levo or Synthroid or whatever it was. And I thought the same thing as you did. Yes, I have a diagnosis. I have a medication. This is going to change my life. And then 5 months later, nothing, not a pound lost, not 1 pound, no difference in energy. My hair didn't grow back, still falling out. So that's when I started my Dr. Google search, right? Like we all do. We get frustrated. We start looking for answers, like what the heck's going on with me? Then I find this T3 information and I go back to my doctor. I'm like, hey, there's this T3 thing. And turns out it works really well when you pair it up with T4. And now back then I didn't know that I had a reverse T3 problem either. Usually, like you said, it kind of comes out over time. You might do really well with T4 and T3 in the beginning. So I asked her about T3. She said, not going to do that. So like any pain to purpose story, I found my functional medicine practitioner. He became my mentor, changed my career trajectory. And really, I mean, I was at the point where I said, if I'm this frustrated, other people are too. And that's really what led me down the functional medicine, specializing in the thyroid path, because so many, just like we said in the beginning, so many are going undiagnosed. What if I would have stopped at doctor number 1 or doctor number 3? Or what if I stopped at doctor number 6 and just said, well, doctor's right. I must be normal. It must be my fault. I must be doing something. Like, no. So yeah, I mean, just through a process, then also, like, we are the reverse T3 sisters. My reverse T3 went up. If you give me T4, I get worse. So change of medication along the way, all leading to an optimal state. And that's really what we want to look at, is how to make you optimal. And a lot of that is looking at what is causing it, what is driving it. So yes, believe me, I love proper medication for someone. I love it, right? We want to give you the right amount of thyroid hormone replacement therapy if you need it in order to make you optimal, make you feel your best. But also, let's look at the causes. Let's look at what's beneath the surface, because sometimes if we fix that, if we fix those underlying issues, all of a sudden your thyroid works better. And then it's like, hey, maybe you don't need med, or maybe you need less, or maybe you need, and then we just optimize your life.
Yeah, exactly. So did you end up getting diagnosed with Hashimoto's then too?
Well, it was kind of like a process of elimination diagnosis. I think if I look at, they did the thing that I see on my patients now. They tested one.
Yeah.
They tested one antibody, forgetting that there's 2 antibodies that you need to test. And it came up that I had, 10 antibodies at the time, but the reference range is less than 20. So that means, and again, in functional medicine, if you have antibodies, those are antibodies against your thyroid. That is Hashimoto's. Might be the beginning stages of, or it might be that you've just taken care of yourself for so long that you have itty bitty antibodies, but they're still antibodies. So yes, I mean, the fact that autoimmune begets autoimmune, where we see one, we see more than one. I have psoriasis. That's autoimmune. I had antibodies in my one antibody, my TPO, it's Hashi. I don't need to be tested 5 other times to tell you that. Plus, I've been on T3 and been gluten-free for so long, I probably wouldn't show up with antibodies right now anyways.
Right. Yeah,
Yeah.
exactly.
Yeah.
So let's get into how is it that the over-exercise extreme dieting caused it? And how do you see that in your own clinical practice?
Right. So that's a big one. All right. So we know if we start off with 90 to 95% of all hypothyroid cases are Hashimoto's. So if we start with the autoimmune premise, all autoimmune diseases start with a genetic predisposition. You can look back at your family and say, hey, did anybody have type 1 diabetes? Does anyone have Crohn's? Does anyone have RA? Does anyone have lupus, MS, psoriasis, all of these autoimmune conditions? Or, hey, Hashimoto's. How about your gram? How about your aunt? Did they have Hashi? So then you have that genetic predisposition. And you add a stressor on top of that. And we'll get into the other piece of that with food and gluten and all that. But you add a stressor like extreme dieting, extreme exercising, which I'm totally guilty of doing when I was in show mode. I mean, I was at the gym a couple times a day. That's a stress on the body. So now you're going to turn on that autoimmune switch. Now that light switch turns on because of a stress. I mean, we see it right with any kind of stressor, hormone changes, perimenopause, puberty, pregnancy. The 3 Ps are a big one, but with over exercise and dieting, over dieting, over restriction of your calories, that can turn that switch on. The other thing that over dieting and over exercising does is it lowers your free T3. So now you have this autoimmune surfacing and you're pushing down your active thyroid hormone T3. You're totally going into a hypo state. I mean, your cells can't function without T3. So that stressor on the body can turn on the autoimmune component, and it can also indirectly push down your free T3 level.
Yeah. Yeah. And I just saw somebody the other day. I saw her lab work and I got her to test the full thyroid panel, whichever one. This is where you start. You test both those antibodies. You test your reverse T3. Don't just test TSH.
Yeah.
But her antibodies were quite high and her thyroid was normal as far as levels. Like she had appropriate levels of free T3, appropriate levels of free T4, but yet she had high antibodies. So this is why it's so key, I think, to make sure you do test for both those antibodies, because you have to think, like, if you've got antibodies, that's a sign that your body is destroying your thyroid. Yes. So you need to catch it now before those thyroid hormones start to deplete.
Yep, exactly. Yeah, exactly. Catch it early.
Yeah. And I've actually also heard that Hashimoto's is the gateway autoimmune condition, in the sense of it'll be the first autoimmune to develop and many others can follow. So it's like this gateway is like the first autoimmune condition that you'll get because of whatever root cause is causing it.
Right. So like we said, where we see one, we see more than one. A lot of times people will walk around, because thyroid is so undiagnosed, people will walk around with not latent, but undiagnosed Hashimoto's. And like you said, that could have been the very first one. And you'll have people say, but I have Crohn's disease, but I have celiac. Those came first. No, those were diagnosed first.
Right.
Yeah. Those were diagnosed first. Hashi is often undiagnosed because of just what we said. People are not getting properly tested. They're only having maybe one antibody tested, if you're lucky to get your antibodies tested in the first place. So yeah, it's definitely the gateway for other autoimmune conditions.
And so you would say that 0 antibodies is what's best?
Yeah, I say 0. Now, antibodies do fluctuate. Right. So let's say we go through a stressful time. You're working long hours. You are taking care of a family. Somebody lost their job. You're going through a divorce. Any kind of stressor can push up those antibodies. And you're going to get into kind of like the co-infection stressor, because then we can see antibodies go up as well. Sometimes what you eat, you want to go on a gluten fast, you might see your antibodies come up. So there's different things that will make antibodies fluctuate, but for the most part, we want to see them at zero or close to it as possible. We want to see a decrease when we're addressing things in your life, like the underlying infections and hormones and insulin, everything we're going to talk about today. We want to see them go down. So yeah. So for you, did you have high antibodies?
No, I always had some antibodies, but never flagged, of course, right? And like you said, they fluctuate, but on the very low end. So it wasn't something that I ever really dove into too hard for myself, for my own diagnosis. But I do see almost everybody that has hypothyroidism with some antibodies. Like I think that it's almost across the board that most people, and that is so. The Hashimoto's is a root cause of hypothyroidism, but then you have to get to, if that's the cause, then you have to get to the root cause of the Hashimoto's, which can be quite different, right? So we kind of go into a couple different levels there, and that's a whole nother podcast as far as autoimmune Hashimoto's go and what could be the root cause of that, or how you could treat it to get better, right? You know,
and some of the things you're going to talk about could be the root cause. They cross over. Everything crosses over.
Everything crosses over. Yeah. So when it came to my own, once I discovered that I had this crazy reverse T3 problem that was making me so sick, I had to then go through, okay, what could be the cause of a high reverse T3? And like you said, it can be from extreme dieting. That can definitely be it, or high stress. And so, I'd started with, okay, what's my cortisol doing? My cortisol was low across the board, same with my DHEA. So I knew I was in some adrenal insufficiency, but I didn't have high stress in my life. Like I'm actually pretty good at like self-care and not, doing too much. I probably work too much for sure, but just in stress in general, I'm not this like really highly stressed go person. I make sure that I take some time to myself and all that. Right. So I was like, if my adrenals are down, my thyroid's down, my reverse T3 is up, one of the other causes of low adrenal function is infection. So I thought, I think I've got something going on in here. So I started with mold, and this is where I want everybody to start too. Like what I'm going to talk about here today is definitely like what you have to go through in order to get to these root causes, right? Like you start with testing, see if you've got the antibodies, is it Hashimoto's? And then, you can go to, okay, let's test for these hidden infections that can cause these problems. So I started with mold, and that can be easily done by just going to what's called the visual acuity test online. So cheap, right? It's like $10. It's like, just do it. Because actual mold testing is about 500 here in Canada.
Crazy. It's crazy.
And so to know whether or not it's worth the money to spend to actually test for it, you start with this visual acuity test. And oddly enough, mold somehow affects your visual, but you don't notice that. But you take this test online, and it'll tell you, and it's 95% accurate, I think, right, Amie?
It is. I mean, to save $490, I would say I'll roll with that 5% inaccurate to take the 95% accurate.
Exactly. So I didn't think I was ever exposed to mold, but I was like, I just have to start ticking these boxes off. So take the mold test. It said that I didn't have mold, but that I was fighting something. And then it could be heavy metals. That's what the test told me. And I was like, oh, so I went on to Wendy Meyer's site and I took her heavy metals quiz. Came out that I didn't have anything. Like I was like, no, didn't have any of these typical symptoms. So I was like, I really don't think I have heavy metals, but I'll just go get it tested just to rule it out. That's what my headspace was about it. So I went to my naturopath. I said, let's do a heavy metals challenge test. And we did it. And I came back as there's, mild, moderate, and severe. I was at the very end, as far as the line could go, in mercury and lead. So I have massive amounts of mercury and lead in my body. And I was like, what? I have never had a filling in my life. So that's why I thought there's no way that I've got mercury poisoning. I've got no mercury fillings. Well, it goes, I guess your mother, if she's got mercury fillings, she'll pass on half her mercury load to the fetus,
Yes.
to the baby.
Yep.
So there I was born, I think from her load of merc, she was filled with them. So I had that. I was vaccinated, like most children are. Vaccines, especially at that time, were full of thimerosal, mercury.
Yep.
I was raised in a very old house that was built before the 1970s, and all of those houses lead piping.
Yep.
And it's just, I think it's just so much in our environment. I recently retested, and they did a pre and post provocation test, which means that they tested me before giving me what's called a chelator, just to see how much mercury and lead is swimming around in my body just on average here. And they were still moderate levels. So that means that I'm getting current exposure from my environment. And now that I've researched it for about 2 years now, I've really gone down the rabbit hole on heavy metals. Every one of you have heavy metals. We are all exposed. There's no getting away from them. And there are no safe levels of lead in the body, just so everybody knows. Like there's not even one. Whatever the unit of measurement is, not even one is safe. And so if we're all being exposed, it's like, well, why don't we all have thyroid symptoms then? Well, some of us have great detoxification ability and can get rid of these heavy metals and are not affected by these heavy metals like other people are. But if you've got detoxification issues, maybe your liver's not up to par, maybe you drink too much, maybe you've got the MTHR, maybe you just have poor, just poor detox pathways, which can absolutely happen. And they can get clogged up, right? We're exposed to so many toxins right now.
And it can vary from month to month. You could, your liver can be burdened just from toxic exposure and supplements and food that you ate, or excess alcohol if you went on vacation. Like it can vary month to month. So 1 month you might be processing and the next month, not so much.
Yeah. And people are being just born into this world now. Like babies are having hundreds of different chemicals in their blood when they're born. So we all have it. We just all are being affected by it differently. I think heavy metals are definitely a root cause to autoimmune conditions. I mean, the list really does go on to Alzheimer's disease, any sort of hormone dysfunction. Heavy metals can cause that, can cause anxiety and depression, mental disorders. I mean, it's pretty crazy. So I really believe that was my root cause, and it still is. I'm in the process of chelating, and it's definitely, I'm starting to feel better, but chelation takes years to get rid of lead and mercury. So, but mercury, it does hide in the brain. So it can affect what's called your pituitary gland, which then can affect the thyroid. Also, it has an affinity for the thyroid. Mercury, lead, and cadmium, but especially mercury, will occupy. It has a similar makeup to iodine, and will actually occupy the iodine sites in the thyroid. And you need iodine for thyroid to function properly. So if you've got lots of mercury, it's going to occupy these sites, and it's going to start to destroy the thyroid function. Yeah. Because mercury, you're not getting the iodine. Toxic. Yep. It's so toxic. And once again, there is no safe levels either of mercury. It's you don't want any. And if you have mercury fillings, 100%, they leak. And don't believe a dentist that tells you otherwise, because it's not true. They vaporize. And definitely the longer you've had them, the less vapor, because they harden, but they still will be leaking. And it's like they vaporize up into the brain, right? And into the soft tissues of your mouth. And and then down,
just think, mouth here, thyroid here. What's going to happen?
Yes. Yeah. And so all of those, like even aluminum, there's evidence that exposure can affect the parathyroid glands and suppress the release of parathyroid hormone. As I said, the mercury and iodine are chemically very similar. And so your thyroid will quickly absorb and store it, and that will occupy the iodine receptor site. Mercury's got the affinity for it, and will actually cause inflammation, low body temperature, and the hypothyroidism. And then lead as well. There's evidence to support both, that lead does cause problems. And then there's also some kind of mixed research on it that I found. But I mean, I think that it 100% does.
Yeah.
From my own experience.
From your, yeah. Well, and we know it just from your experience and from medical literature. We know it. We know it. Now, let me pause right there because I know our listeners are going to be thinking immediately, because as soon as they hear something, they're like, I got to get tested. How do I get and you and I are budget practitioners. We're not out to make people spend, millions of dollars on functional testing and all that. So I did have my heavy metals tested, but I just went with the serum because two reasons. Number one, I wanted to get them tested. Number two, I wanted to see the accuracy of a blood test that my nurse practitioner ordered that was covered by insurance. So I didn't have to spend $500 on a heavy metal panel from a functional, lab somewhere, because I want my patients to be able to do the same. I don't want them to have to spend money. But in your experience, is a blood test accurate enough, or do we have to go the route of functional testing, or what's better?
I think you have to go the route, unfortunately, of functional testing because, like I said, mercury has an affinity for the brain. It will hide in the brain, and that won't show up in blood. Lead stores in bone. So it'll store itself in bone unless it's given a chelator, which a chelator is a supplement that you take that pulls these heavy metals out of the organs, out of the bone, so that you can see what the load is of those heavy metals. It does. Oh, I have heard that it overshows. Like there's no super great test for heavy metals. That's what I've heard. So you've got the option of serum, which is going to test any exposure that you've had recently. Like if you just ate a bunch of tuna, or you had some crazy exposure for some reason, maybe you've got your mercury fillings taken out improperly.
Right.
If that's the case, then you will have immediate exposure in the blood, and you could test that via serum. Urine, they'll give you this chelator, which then pulls these heavy metals out of their storage places, but it will overshow. That's why it's good to get the pre and post provocation. So you can kind of go, okay, I do have some definitely. And then so kind of go in between those two results. And that would be kind of what you would say, okay, this is how much I have. So I would say I'd probably have about 3/4 of the line up, not all the way, which it showed when I was provocated. Mm-hmm. So doing that. And then there's hair analysis. So just so everyone knows, the provocation test with a naturopath will usually run about $200. There are ways that you could do this though on your own at home, so you don't have to pay the visit, but you have to do it in a certain way. So there's tests from Everlywell, ZRT does them, where they test for like urine test for heavy metals. Yeah. But what you'd want to do is take a chelator first, which they don't tell you that in the kit. So you take a chelator so that you pull them out, then take the test to get more of an accurate reading. And that would be a cost-effective way to test. Or you can do hair mineral analysis testing, which is probably the most popular way of doing it because it is so inexpensive and so easy to do. So it's $100. I sell them in my shop, and you take a piece of your hair, you send it in, and they test for heavy metals. But once again, this is only going to test if you've had any exposure in the last 3 months. So it doesn't test what's stored in the system. So if you're eating a lot of fatty fish that has mercury in it, it'll show up in the hair. But a lot of the other ones, they won't. And so what you have to do is get an understanding of what it looks like if you have mercury poisoning. It will affect the minerals in the body, which I think is another reason why it causes hypothyroidism, because it can cause a deficiency in these minerals. And so if you have somebody that knows how to properly read a heavy metal or hair mineral analysis test, they can look at the minerals. So it looks like you have no heavy metals, but by looking at the minerals and seeing this deficiency in them, they can say, you know what, you do actually scream mercury because look at where your minerals are. And then you can go ahead and treat that. But I find that most people won't take that as yes, they have heavy metals. It's better to see the hard, like, here it is kind of thing. So I definitely go for provocation.
Yeah. I like CRT. I like your idea of doing the chelator before and then using CRT. Yeah.
Yeah. Yeah. And you can do that. Like, you can get EDTA, which is a chelator. You can buy that on Amazon. And some people, just as a warning out there, some people, it does make them very sick to have a provocation test, because if you are, for instance, if you've got mercury fillings, I would not suggest doing it, because you're going to get sick, because you're pulling the mercury out of your teeth into the system.
If you have mercury fillings, guess what? You have high mercury. Like, you don't even need to test. You need to see a biological dentist to get your fillings out first. Don't even save your money. Like, don't even
save
bother.
Your money. Yeah, exactly. So you have to be careful if you're chronically ill. I would definitely start with the hair test, because it's not the least invasive, and have somebody to properly read the mineral levels, and to see if they think that you have mercury. But because you need to do it carefully. Throwing in a heavy amount of chelators to test, which is what they do with provocation, usually get an IV therapy done, and they fill you full of this chelator agent. It can cause what's called redistribution of heavy metals. And so they throw it all in, you can't pee it all out, and it'll redistribute throughout the body and make you sick. So you have to be very careful.
And that is why, let me side note that is why, like you said, it takes years to detox from heavy metals, specifically mercury, because it does cross the blood-brain barrier. It's one of the only heavy metals that can enter the brain. So, these detox protocols, quick fixes, cleanses, all that, you're not going to get rid of mercury in 3 to 6 months. It's most likely going to take a couple years. That's one that you have to be patient on.
Absolutely. Yeah. Patience. And so the other, just to touch on some other infections that could cause hypothyroidism, and I want to hear your take on this too, Amie, but Lyme disease, I see a lot of Epstein-Barr virus, and I was taught by Dr. Kylie Burton. She was on my show recently, and I think she was on your show too. She's fabulous, but she taught me how to read labs. And she says, if you see monocytes, which is on a typical blood work, your doctor will give you, and it might not be flagged. And even if it is, they don't say anything to you. Right. But if you're monocytes, so you can look on your test for monocytes, and if it's above 8, especially over 10, that is a sign that you have Epstein-Barr virus, which is mono is the best way to chronic mono. We all have Epstein-Barr virus, or 95% of the population has Epstein-Barr virus, but it's whether or not it's dormant or active, and if it's chronic. And so a lot of chronic Epstein-Barr virus can lead to hypothyroidism. Mm-hmm. Yep. Yeah. What do you see as far as do you any other infections?
So just real quick on the Epstein-Barr, it's kind of funny because a lot of people don't, you hear this too. I never had mono. I go, yeah, you did. You probably just stayed home for a few days from school.
It was like the flu.
Your mom didn't take you to the doctor, but you had mono. Right. Easily 95% of us have that latent EBV. And I like to explain it to people. More people can understand in terms of chickenpox, because you had chickenpox, right? So now that at any point in your life, you can get shingles. Maybe you won't. You might walk through this lifetime and never get a shingles outbreak, even without the shingles vaccine. You might never get a shingles outbreak, but it's there. That virus is living in your system. Same with EBV. You could go dormant your whole life. It could never bother you ever. You could feel fantastic. You take an Epstein-Barr virus panel, it shows 4 different markers. One of them is an active marker. 3 of them are dormant markers. Those dormant markers can be high. If the active one is not, then it's dormant. You don't have to, and then we have to kind of pair it up with, like you said, is it chronic? Is it affecting you? Do you feel okay? Like when I tested mine, I'm fine. I have no symptoms. I'm fine. I'm optimized. I'm good. I just did it just to see. I go, yep, there it is. Look at that. It's dormant. Go figure. Me and everyone else. But it wasn't active, so there's nothing to worry about. Epstein-Barr virus is a big one, especially when it's active. And then, like you said, Lyme disease. I did a Lyme panel too, and I did a Lyme and tick-borne. illness.
Okay.
So I tested positive for Babesia duncani, which is some Utah tick. Never been to Utah. Not
Oh,
yet, at
weird.
least. Some Utah tick that decided to bite me. But again, it's like, I look at it as it's data. I don't need that data right now to figure out everything because everything's fine. But it's data. So I know that that's there. I know EBV's there. If my body ever goes haywire, then I retest those and see, am I in an active state? Did something go up? Is that the underlying cause of why I feel like garbage? So that's kind of how I tie that in. A lot of patients do have chronic Lyme though. What
Yeah.
have you done in your practice with the
I
Lyme?
am not super well versed with the Lyme stuff because you really to even it's hard to test. One of the more accurate tests I do believe has to be done in Germany. I don't know if that's still the case, but a lot of the time you'll test the antibodies and they'll come back normal, even though a person does have Lyme disease. So it's definitely one of these like crazy chronic illnesses that gets misdiagnosed for years and years and years, but it is very, very prevalent right now in North America. It's that we've got like an epidemic of Lyme disease right now. So it's crazy. Yeah. I just don't have the means to treat it. So I don't think I just don't test it because I don't have the means to treat it. But if I suspect that somebody has it, I'll tell them, you should go and see somebody that can test this. Yeah.
Well, with Lyme now, it's not tick. Lyme can be transmitted sexually. It can be transmitted via a mosquito. So now we know that the transmission of Lyme has expanded. So more and more people do have it. More and more doctors are acknowledging it, but not testing properly. And you're right. Sometimes I'll just see like I don't know what it's called, like an IgM or something for Lyme, but there's so many bands. So there's the Western blot. We get into the ELISA test. And by no means I mean, you have to be a Lyme specialist to know all the different things about Lyme. I mean, there's so much to it. So I couldn't rattle off all the different testing, but I like to see it. I like to see it in my patients. So I tell them just ask for a Western blot. So at least I can see all the different bands. And there are certain bands that like a 41 kDs is positive. Hey, no big deal. But if the 52 band is positive, then that's kind of an issue. And there's so much to it. But just to know that Lyme or chronic Lyme, it's going to cause inflammation. That inflammation can downregulate your thyroid. It can cause conversion issues. It can cause other symptoms in your body that mimic hypothyroidism. So you might think, hey, my thyroid's tanking, but you're just really freaking tired from the Lyme disease.
Yeah.
So, yeah.
Yeah, I did a great interview with Dr. Jay Davidson, who is a Lyme expert.
My guy, yeah.
And it was on my thyroid. I did an advanced thyroid series and he was on it talking about the connection between Lyme and thyroid. So if you suspect that maybe Lyme is an issue for you, then I would recommend just listening to that podcast and just seeing if it relates to what you're going through and go from there. So yeah. And then parasites too. Parasites are another infection that can affect thyroid function, is just because of what's going on in the gut and what it can do with autoimmune conditions. And just so everybody knows, both Lyme and parasites often go hand in hand with heavy metals, and both of them will hide inside heavy metals. So the heavy metals actually protect these microorganisms, the Lyme, the parasites. So even when you try and do this detoxification or killing off of Lyme disease and parasites, a lot of the time you can't get rid of them until you get rid of the heavy metals.
Mm-hmm. Yep.
So that's deep stuff. I understand. I'm sure everybody's going, okay, ladies, you're confusing the hell out of me. But this is like I said before, just start knocking them off the list. Like Amie tested her Lyme. She tested her heavy metals. I actually haven't tested. That's the one thing is Lyme. I haven't tested for because I kind of stopped at the heavy metal thing. But you just start ticking these off. If you've got hypothyroidism, you just go through one by one, and financially you might be able to just test one every 6 months, but just start going through them so that you can start getting to the root of the problem.
Yeah, and that's the big thing. We don't want everyone to think that they need to run out right now and spend all this money on all these different tests. These are just pieces to think of to connect what caused your hypothyroidism. And if you're not feeling well, if you're not optimized, if it's not just a situation of, I'm just not on the right medication. If you feel like you're on the right medication, you're on the right dose, you felt good for a while, like you did, Karen, you felt good for a while. And then like, what the hell, what happened? I'm feeling like crap again. What's going on? So then that's when we kind of look deeper. When I first work with a patient, I'm not like, listen, we need this and we need heavy metals and we need that and we need that. It's like, let's start with the basics, because you're going to make people will lose their mind if you tell them they need that many tests. Let's start with the basics. And then if you're not feeling better, we can start peeling the onion and get to the other layers that could be causing you to not feel well.
Yes. Yeah. I approach it the same way, which is, let's get you optimized on medication if we can, first and foremost, so that you'll even just have the energy to get to the root problem, right? I always say, like, let's just get you feeling better. And sometimes that is all somebody needs. It is something they may have picked up from a family member, or, it's genetics, or you might not have certain enzymes, the deodoinase enzymes and thyroid. And that could be one of the causes that is just a matter of, you just need to be on medication for the rest of your life, period, or you're just this bad converter, whatever it might be. There is those people that it is just a matter of, you need to be medicated. Yeah. But that is the place to start. And then, like you said, if you're not feeling that great, or you're wanting to get to the root of the problem, then you just slowly start going through these things. So next up, I wanted us to jump into the correlation between our hormones, different hormones, and thyroid and hypothyroidism being the cause of hypothyroidism or contributing to hypothyroidism. So, Amie, estrogen, we love it and we hate it, right?
Yeah. So, want it for nice, smooth skin. We just don't want too much of it. So estrogen dominance is a huge issue when we're talking about that T4 to T3 conversion. So if you have a high reverse T3 problem, let's look at your hormones. Let's look at estrogen and make sure that you're not in a dominant state, because we know that estrogen increases the protein thyroid binding globulin that carries the thyroid hormones in the blood. So if we have too much of this protein, then not enough thyroid hormones will be free and unbound to enter the cell. And we can talk about how to test this. We're going back to this whole money thing, budget thing. I like to start with the serum, because if someone has insurance, listen, that's why you have it. Let's test your serum. Let's try to, target it day 19 to 22 of your cycle. And let's just see what your numbers are there. And then we can kind of move into, hey, if we're doing a 4-point salivary cortisol panel, let's throw in the salivary hormones too, because that's cool. And I like to compare saliva and serum as well. I love seeing especially if we can time it on the same day, this month. It's so cool. And then the Dutch test, I'll let you speak on a little bit more. I don't use it often because of the price. And again, that's one of those like, okay, if we can't figure out your damn hormones with serum and saliva, and maybe you're not, methylating properly, and there's this issue over here, then we move on to the Dutch. But I don't use it that often. I want to know your opinion on that.
Yeah, there's a fly buzzing around me. I don't know if you guys can see it in the video if you're watching the video, but it's like crossing across my face like every 2 seconds here. But so I do use Dutch, but it is expensive. And so I do way more saliva than I do Dutch. I always say it really does depend on where you are. Like if you're a cycling woman, I think it's best if you can afford to do it, to do either saliva or urine testing, because it's going to be far more accurate, because you can have normal levels of estrogen in the blood because you're testing what's called bound hormone levels. And then you'll have something completely different in saliva, which is free hormone levels. And then the urine's going to show you how you're metabolizing these hormones, which is super important piece as well. And so if you're dealing with a lot of hormonal dysfunction, you should, lean towards the saliva or the urine test for more accuracy. But like you said, Amie, if you can't afford it, just do the serum, because it's better than not doing anything at all. And it's a good place to start, so that you can see, like, maybe if it is reflected in that, then you can say, you know what, it is a kind of on the low side. Maybe you do want to spend the money and do saliva, or, you know, you're still experiencing all of these symptoms, but these look normal. Maybe you need to do the saliva or the urine testing. The saliva, the comprehensive one, it works out to be like $275.
Yeah.
So, you know, I always say, if somebody is having a hard time affording that, I can always split the price up. I'm sure you could do the same. Maybe, like, there are things that you could do, you know, or save up the money for it. I always think too, like, if somebody said, you know, that you could buy a house for $275, you'd find the money real fast, wouldn't you? So, you know, put your health first and just go, okay, maybe I need to save up for this, because testing your hormones as a hypothyroid patient is definitely, I'd say, one of the top things that you can do to optimize the weight loss piece, wouldn't you say? Like, because if there's estrogen dominance and hypothyroidism, and that estrogen dominance is the root cause, well, clearing that estrogen out is going to make your thyroid function better, and it's going to make you lose weight. So getting it tested, I think, is just like, it's a must have for sure. And then as you age, I think if you're in menopause and you don't have any estrogen and progesterone, that will be reflected in serum levels. And then you can test via serum. It's going to be more accurate if you no longer have a period, or if you're farther into perimenopause. So serum can be better for that. And then I like urine for if you're starting hormone replacement. It is good to see how you're metabolizing those hormones.
Oh yeah.
Via urine. Yeah.
And that's the Dutch. Yeah.
Yeah. That's the Dutch. So spectrum there of price, cost, and etc. But I think it is definitely worth doing 100%. Yeah. Some of the other hormones that I see affecting, of course, is progesterone. Progesterone will do the opposite of what high estrogen does. So progesterone can decrease thyroid binding globulin and increase the activity of thyroid. And I will say low estrogen can also cause hypothyroidism. It's really hard. No, you want that Goldilocks always with the hormones, right? It's going to, but there isn't a ton. There's more information on estrogen dominance in thyroid than there is estrogen deficiency. But we see hypothyroidism happening in menopause.
Yep.
So you'll go your whole life, never have a thyroid problem. And then suddenly you've got hypothyroidism because you're losing your estrogen and your progesterone. And estrogen stimulates thyroid growth. So too little estrogen may result in not enough thyroid tissue. And it stimulates the thyroid to make thyroid hormone precursor thyroid globulin. So you want that perfect amount. So if you're going through perimenopause and menopause and you see that your metabolism is dropping, your basal body temperature, or you get tested and it's low, it could be because you need the estrogen and progesterone. And from what I've read, it's about 20% of women can develop hypothyroidism from perimenopause or menopause.
Right.
And so what about insulin, Amie? I know you love insulin and thyroid.
I do. I'll share insulin with you, but I do love insulin. Well, because we see so much insulin resistance with hypo. So we see it go hand in hand, whether it's coming in the form of PCOS, polycystic ovarian syndrome, or it's just you have high insulin because maybe you've been eating processed food, you're eating too much sugar, you're eating too many carbs, or your thyroid is off and your insulin signaling is off as well. So it's kind of like a back and forth feedback. But I always say having insulin resistance and hypo is like the double whammy to your metabolism, because you have two different things going on that's driving all of those hypo symptoms. Insulin is very inflammatory. It's one of those crazy hormones. We need it for life. We need insulin for life, but we don't want too much of it. So it's like, I call it the Jekyll and Hyde hormone, because on the one hand, needed for life, other hand, it literally becomes the fat storage hormone. So I want you to think of insulin as like being really inflammatory and just grabbing fat and storing it on your body. It's just storing fat. A very rudimentary explanation of insulin, but that's how you have to think of it. You don't want too much of it, but it is needed for life. So where we see issues with the thyroid is, let's say you are walking around eating whatever you want to eat, right? You're a high carb eater, you're eating a lot of sugar. Chances are you are going to move into that pre-diabetic state or insulin resistant state. And your cells have some of their doors closed for insulin. So the insulin can't get into the cell. Glucose, you'll see it in your blood glucose readings. Those go up. So if you're pre-diabetic, diabetic, you know, your blood glucose readings are 200, 300, 400. They're pushing higher and higher on a daily basis. And that insulin can't get into the cell. That's creating this big time inflammatory state, big time inflammation in your body. And that high insulin will not only impair, again, going back to reverse T3, it's going to impair T4 to T3 conversion. It's going to drive up reverse T3. So that's going to go higher. And when reverse T3 is high, metabolism goes down. So I know I'm kind of going in all different directions with insulin and reverse T3, but reverse T3 is the survival mechanism of our body. So if you're in the ER, the ICU, it's going to go up. Because your body knows you don't need to be burning fat and growing hair when you're in a traumatic state in the ICU or ER.
Conserving.
So, yeah, you're conserving. You're in conservation mode. So if you're walking around with high insulin and you're not in the ER or ICU, but your reverse T3 is being pushed up because your body's basically saying, oh my gosh, this person's in this inflammatory state all the time. Their insulin is so high all the time. Here goes reverse T3. They don't need a metabolism. They need to take care of this insulin deal thing. So reverse T3 starts going up, metabolism goes down, thyroid function goes down. So everything slows down, all because you're walking around with high insulin. Now, yes, it could be choices you're making, poor food choices. It could be that you have polycystic ovarian syndrome causing insulin resistance. It could be that you're not quite optimizing your thyroid. Mm-hmm. And then your insulin signaling is off, because we always see insulin resistance with hypo. And then that high insulin is making your thyroid work even less than what it was in the beginning. So it's just kind of like a ping pong effect, like bad thyroid, high insulin, poor thyroid function, high reverse T3, low free T3. It's a bad scenario all the way around.
Yeah. And then low blood sugar will also cause hypothyroidism too. Like your body needs, and you'll see that in like the low carb ketogenic intermittent fasting world, where you see people downregulate their thyroid function because they're not getting enough glucose in. So once again, Goldilocks, we need that Goldilocks amount.
Yeah.
But yeah, so insulin, super, I see that always hand in hand with thyroid. And it's always a tough call as to which do you treat first, right? Because the way to treat insulin resistance is through the lower carb diets and intermittent fasting, but then that can downregulate your thyroid production. So it's kind of trying to figure out, okay, what do we use, and to address both kind of at the same time. And I find that as well with the adrenals, like cortisol is another hormone that will get involved with thyroid function. And I know, Amie, you'll agree to this. Every thyroid patient has an adrenal issue, I think.
Most everyone, right. And now they will think that, they probably say this to you too, my adrenals are blown out. I have a fatigue, because they read it 5 times.
Yeah.
And it's not necessarily the case that you are in true burnout, because that's low. That is low cortisol all day long when we test it on a 4-point. And cortisol should have a curve. It should start high in the morning and go down throughout the day and be low at night to chill us out and let us sleep. If you really, the only time, honestly, Karen, the only time I've ever seen bottomed out cortisol is with a patient. I'll never forget her, because when we got her results back, I was like, this makes complete sense. She had gone through a divorce, lost money in the divorce, and lost her 22-year-old son in a drunk driving accident, all in the same year.
Trauma.
That amount of stress. We probably could have tested her at some point and she would have been high across the board, just high cortisol all day long, just pumping it out. But eventually the body says enough. And now she's in that low state. Not many people walk around all the way low or all the way high. No. It's normally these periods throughout the day that just get funky. like, oh, this one's really high. And then you're high at night. No wonder you can't sleep, and you're low in the morning. No wonder you can't wake up. Things like that is what I say.
And there's a relationship between thyroid production and cortisol production. They both have a circadian rhythm, and thyroid, if there's not enough of it, it's supposed to come on early morning hours. It comes up and it's supposed to trigger cortisol to come up. And so if you've got no thyroid hormone, your cortisol can be low. And so there's a lot of practitioners out there that say, well, we're going to treat your adrenals first instead of treating the thyroid, and in hopes that that will fix the thyroid problem. And I find, and this really came from L. Russ, who said, no, you got to treat both at the same time.
Yeah.
You know, you can't just do one without the other, because it could be that because the thyroid's so low, that the cortisol is low as well. But cortisol too high or too low will really affect thyroid function, especially within the cell. Like cortisol will stop it from going into the cell working properly. It'll also block a lot of the other hormones, which then can affect thyroid. So doing an adrenal test, I think, is definitely a very important thing to have done if you have hypothyroidism, so you know how to treat it, and high cortisol and low cortisol, two very different treatments. And so that's not something you want to guess at. You don't want to just start taking random adrenal supplements, because it could lower it when it's already low. And they mimic, a lot of those symptoms mimic each other. So really, I think it's so important to look at cortisol function. Don't guess at that one ever.
And that's an easy, cheap test.
We've been
talking about test. A 4-point salivary cortisol from ZRT. I don't know if you sell it on your site. Okay, perfect. It's not expensive. And that is the best way. Cortisol is the one that I will say, don't bother with blood. No. If your doctor throws it in and you want to look at them, just don't even bother. Just whatever.
Don't even bother.
Yeah, do the 4-point, because we want to see the pattern. And you're right. Don't just take ashwagandha because you read it in a forum or on Facebook that you should be taking, or an adrenal glandular or something like that. Like, you know your numbers first before you start randomly treating.
Yes. So we're running out of time here, folks, but a couple quick things that can also relate to the thyroid and hypothyroidism. A big one is gut health. We talked a little bit about that with other stuff, like your conversion of T4 to T3 happens in the gut. So if you've got the parasites, you've got heavy metals, candida, H. pylori, simply leaky gut. And we know that all autoimmune patients have leaky gut. So if you've got Hashimoto's, you're going to have to treat the gut health in order to treat the thyroid as well, to have that conversion. What else, Amy?
Well, stop on the gut, because I know you did. Now I'm going to blank on this. I know you talked to somebody. I think we both like GI map, right? But your GI map showed things that another test didn't show. Like, I like GI map too. I really like that. That is one test that I would say definitely invest in. If, again, as we're peeling the onion, if we feel like we really need to see what's going on in your gut, because you're not responding to thyroid treatment, you're not responding to hormone treatment, you're not responding to everything that we're doing, and it doesn't make sense.
And you're bloated and you've got constipation and you can't eat anything without your stomach looking like you're 3 months pregnant. Well, that would be the test to start with before you go to any of the other ones. Would be, okay, let's figure out what really is going on. And I think it runs about 500. Is that right? I think I paid 500 here in Canada, so it'll probably be cheaper there.
It depends whether you add in that leaky gut marker of zonulin, because that pushes it up. It's kind of one of those, like, it's cool to see, but chances are you have leaky gut. So, we could add it on, we could not add it on. Either way. Yeah.
Yeah. And do you sell that?
Yes, I do too. Yeah. Well, you know how the GI map does, you have to pretty much be a patient, and then at least here. I don't know if can they order it from your.
No.
Okay. Right.
No. Yeah. Right. Yeah. You have to be a patient for a doctor of some sort, a licensed practitioner.
They can order a GI map. Yeah. Yeah. I can order it for pay, but you have to be a patient.
Yes. There is one, planetnaturopath.com. He sells it and he'll ship it anywhere, and you don't have to be his patient.
Okay. Yeah. You just need somebody to go over it. because there's no way you can decipher that.
Oh, no, so confusing. Yeah. And so I think his is 500, but that includes the appointment with him.
Going over. Yeah.
Yeah. So, but yeah, that's going to tell you all your parasites, if you've, how leaky your gut is. It's going to say how well you're breaking down estrogen. So it's going to test something called beta-glucuronidase. So yeah, it's a pretty great one. And it will test for the DNA of parasites, which I think it's the only one that does that. So it's very, very comprehensive. So definitely worth it. But yeah, so nutrient deficiencies is another one, like zinc, selenium, tyrosine. Those are all very important factors in thyroid. Iodine, very important factors. And I know you've talked on, I've just listened to one of your videos on fluoride and bromide.
Oh yeah.
I was mad at you, Amie. I listened to the one on bromide. I was listening to talk about bromide and I'm like, damn it, I just had a hot tub, which is full of bromide. And I'm like, shoot. So now I've got to start taking iodine because that will help counteract my bromide.
Right. Exactly. So I get messages too from people like, does that mean I can't use my hot tub? Does that mean I can't go in the pool? It's like, no, we want you to enjoy life. Right. But that might be where we use iodine, because iodine, bromide, chlorine, and fluoride are all very close on the periodic table. And iodine will actually bind to those elements, those, whatever you want to term them as, will bind to them and excrete them out of the body, specifically bromide. I mean, we are very bromide toxic, whether you know it or not, because of it's in everything. Even if you don't drink Mountain Dew, which contains bromide, and even if you don't sit in a hot tub, which you're soaking in bromide, any kind of fire retardant, anything, fabrics, carpets, in your furniture, in our clothes, like you're exposed to bromide all the time.
Wow. Is there a test for it?
That is a good question. I want to say that there is, but I'm still, like I said, your interview with Brownstein triggered me to look deeper into iodine, because I always thought like iodine is the Goldilocks mineral as well. But then I'm like, maybe some people would benefit from higher dose of iodine. Maybe some people who are bromide toxic, we need to bind to that and excrete it out. So I'm still looking deeper into that iodine treatment protocol. And I'm sure in there I'll find a test for bromide. I'm sure there is. There's
gotta be. Yeah. And for fluoride too, because fluoride, you hear of people, and I talked about this in that interview with Brownstein, where people have taken high amounts of iodine and it pushes the fluoride out of their breast tissue, which I just think is like horrific. And he was like, he talks about the story. Yeah. Where he talked about the lady that had the shirt that was all yellow and they tested it and it was fluoride or bromide, one of the two, I can't remember, but just very toxic for our thyroid. And you think fluoride is being put into into municipality water systems. It's being put into all of the toothpaste. You go to your dentist. I've refused fluoride treatment from my dentist for 10 years now, because they're always like, okay, we're going to do our fluoride treatment. I'm like, no, you're not. You don't even come near me with that. Thank you. Right. And you're not touching my children with it either. But so be very careful, because fluoride, like bromide, is also everywhere.
Absolutely.
Yeah.
That could be a separate podcast too. That could be separate. And then liver, I mean, you touched on that already about, all hormones need to be metabolized through the liver. So if your liver is burdened, I recommend doing, and again, we're not talking about detoxes, quote unquote, or cleanses, or I like to call them poopers. They're just poopers. They make you go. A true liver support, a true liver, like improving the function of your liver to remove toxins and to process your hormones once a quarter.
Yeah. That's
once a quarter, just do it. I mean,
and you sell the Designs for Health one too, right? The detoxification kits are fabulous. The phase 1, they both address phase 1, phase 2. It's not poopers. It's not going to have a whole bunch of laxatives in it.
Right.
And what it does is just support and increase both phases of detoxification, which is what you need.
Yep.
Yeah.
Yep.
Okay, Amie, I think that's it. Let's wrap it up. Although there's many more things, everybody, but those are definitely the main culprits of root causes of hypothyroidism.
Yeah.
Right, Amie?
Definitely. No, we covered a lot. A lot. People's brains are going to be full and exploding right now.
What I'll do is Amie and I both will put in the show notes the list, like just we won't get into detail on that list, but we'll just say like, here's the list of what you're going to go through to start knocking these things off until you find the culprit as far as, and you might have a combination of things, right? Because like you said, the heavy metals, it's going to bind to the iodine, but it's also going to affect all of your hormones as well. And then those hormones are going to affect your thyroid, and they're all these things very interconnected. So
yep, absolutely.
They're going to address them all at some point, I think.
We'll put a ton of info in the show notes.
Yeah. Great. Well, thanks, Amie, for doing the co-hosting this episode with me. It's been great. Awesome. We'll have to do it again.
Pair up in the future, no doubt. So
yes, absolutely. All right, everyone, have a great day.